Welcome back to McLaren Port Huron's Today's Health Program. Today I'm speaking with psychiatrist Dr. Tom Brozovich about anxiety. Dr. Brozovich, before the break we learned about a variety of anxiety disorders. How, though, can untreated anxiety impact your long-term physical health?
I think it can have an impact in many ways. I mean, if anxiety is left untreated, it can affect many body systems. I think if you look at how anxiety can affect someone's blood pressure, for example, like you may see someone go into the doctor's office, they might feel anxious or nervous and the blood pressure is taken and their blood pressure is a high reading. And then sometimes when it's taken again after some time and maybe the person has relaxed, it's improved. So you can see the impact like anxiety can have on someone's blood pressure. It can have an impact on someone's cardiac. It can have an impact also on the gastrointestinal system. We see people who have irritable bowel syndrome, and depending on their anxiety level, it may have an effect on how that's feeling. So we can see it has an impact on many body systems.
Sometimes the stigma that's associated with a mental health concern or mental illness prevents some folks from getting treatment. You know, they'll go to the emergency room because they think it might be their heart, but if they find out that it's not, they're reluctant to go and get treatment for anxiety. What is your recommendation for those individuals?
Sometimes there is reluctance. I think the most important thing is to think about anxiety disorders as a medical condition. And just like someone who has diabetes or high blood pressure, for example, we can treat these disorders. There is help there. We can use medication to treat anxiety just like you would treat diabetes or a thyroid condition or high blood pressure.
Now, what are the treatment options for anxiety?
Several different treatment options. I find the best treatment option, and many of the studies will show that it's best to combine medication with like outpatient counseling. Medications can be very effective in the treatment of anxiety as well as counseling.
Are the medications that you would prescribe for anxiety disorders, are they addictive?
There are some medications that are addictive in the treatment of anxiety. Some people can develop to those medications like a physical dependence or psychological dependence. But there are another group of medications, the antidepressants, that are not considered to be addicting or habit forming.
So antidepressants can also be prescribed for anxiety?
Yes, antidepressants, which also treat depression, which is a mood disorder, are also first-line treatment for the anxiety disorders as well.
Now, would there ever be a point that somebody's anxiety would be so bad that they would need a psychiatric hospitalization?
That can be an issue sometimes. I do find that typically if someone does need a hospitalization as an inpatient, that anxiety is typically coupled with depression. Some examples of why someone might need to be in the hospital would be if they're considered a danger to themselves or others, or if the anxiety level has impacted them so much that they're having trouble functioning in daily life.
Dr. Brozovich, this has been great information. Do you have any closing comments for our viewers?
I would say, in closing, if you do suffer from any anxiety symptoms, don't hesitate to get help. There is plenty of help out there for you, including medications and counseling. Also, look at anxiety as a medical condition that can be treated. I think it can be key to just get help and get help early if you can. Try not to hesitate, and that way the anxiety can be treated more quickly and more effectively.
Dr. Brozovich, thank you for joining us today.
Thank you, Michelle.
Stay with us. We'll be back after this break.